There is a map drawn on your hand, not literally visible but physiologically real, in a way that modern neuroscience is only beginning to fully describe. When you press the webbing between your thumb and index finger during a headache, or rub the center of your palm when overwhelmed, or hold your inner wrist before trying to fall asleep, you may be doing something more purposeful than you realize. Today we are going to look at what the science actually says about acupoint stimulation on the hands, what the evidence supports, what the mechanisms are, and which specific points are worth knowing. The human hand is a convergence point for 6 of the 12 primary meridian pathways described in traditional Chinese medicine, specifically those linking to the lungs, heart, pericardium, small intestine, large intestine, and triple warmer. From a biomedical standpoint, the hand is also extraordinarily dense, with sensory nerve endings, mechanoreceptors, and vascular structures that connect through peripheral nerve pathways to the spinal cord and central nervous system. A comprehensive review published in 2025 synthesized evidence from 12 randomized controlled trials examining mindfulness-based finger exercise, which incorporates acupoint stimulation on the hands and fingers, combined with coordinated movement and focused attention. The review found that stimulating hand acupoints may improve fatigue, sleep, joint pain, cognitive function, and symptoms of depression and anxiety through multiple mechanisms, including circulatory enhancement, anti-inflammatory effects, and modulation of the autonomic nervous system. The underlying physiology is worth understanding. When pressure is applied to an acupoint, afferent nerve fibers are activated in the surrounding connective tissue and muscle. These fibers transmit signals through the spinal dorsal horn to the brain, triggering activity in the pain matrix, limbic system, and hypothalamic pituitary axis. The result is a cascade of neurochemical changes. Beta endorphin is released and binds to the same receptors as morphine, producing analgesia. Serotonin and dopamine levels shift, influencing mood and emotional regulation. Nitric oxide is released locally, causing vasodilation and improving blood flow. Cortisol levels, the primary biochemical marker of stress load, decrease measurably following acupoint stimulation. Natural killer cell activity, which plays a central role in immune defense against viruses and abnormal cells, increases. Clinical data specifically from hand acupoint stimulation of Hegu and Nigon points showed significant reductions in the inflammatory markers, interleukin-6 and high-sensitivity C-reactive protein, suggesting a systemic anti-inflammatory effect from local hand stimulation. Now to the 3 specific points with the strongest evidence base and the most distinct clinical applications. The first is Lao Gong, or pericardium 8, located in the center of the palm, where the tip of the middle finger rests when you loosely make a fist. This is the 8th point of the pericardium meridian, which in traditional medicine is associated with protecting the heart and regulating emotional excess. A neuroanatomical cadaveric study published in 2025 confirmed that this acupoint lies in close proximity to a vascular branch of the median nerve, providing a structural basis for its autonomic regulatory effects. Review evidence places Lao Gong among the acupoints with demonstrated influence on autonomic and emotional regulation, with neuroimaging studies showing it modulates brain regions involved in these functions. Clinically, it is used when the nervous system is in a state of overactivation, whether from stress, overwork, or anxiety. Press this point with the opposite thumb, using circular motion for 1 to 2 minutes, 2 to 3 times daily. The feeling you are looking for is a dull ache or mild radiating sensation, which indicates appropriate nerve activation. The second is Hegu, or large intestine 4, located in the fleshy mound between the thumb and index finger on the back of the hand. This is among the most extensively researched acupoints in the human body. A neuroanatomical study identified its close proximity to the superficial branch of the radial nerve, explaining its well-documented effects on peripheral circulation and pain modulation. fMRI research confirms that Hegu stimulation modulates brain networks involved in pain processing and cognition. At the spinal level, Hegu stimulation suppresses expression of P2X3 receptors in the dorsal horn, which are implicated in pain hypersensitivity while simultaneously elevating endogenous opioid peptide levels. Clinical trials have shown statistically significant pain relief from HEGU. Acupressure in labor pain, postoperative pain, menstrual pain, and chronic low back pain. One important caution: strong stimulation of HEGU is associated with promotion of uterine contractions in clinical reports, and pregnant women should not apply strong pressure here without medical consultation. The third is Shenmen, or Heart 7, located on the inner wrist crease at the ulnar side, in the small depression just below the small finger. This is the 7th point of the heart meridian, and its name translates literally as spirit gate, reflecting its traditional role in calming the mind and facilitating sleep. Shenmen is currently one of the most actively researched acupoints in sleep and anxiety research. Studies combining Shenmen with Saninjiao for insomnia treatment have reported significant reductions in sleep onset latency and increases in total sleep time. Clinical evidence also shows that acupoint stimulation protocols incorporating Shenmen reduce waking time during the night by approximately 50% compared to controls. In studies examining finger exercise protocols that include Shenmen stimulation, consistent improvements in sleep quality, fatigue levels, and depressive symptoms were reported across multiple randomized trials. For self-application, use the opposite thumb to apply gentle circular pressure for 5 to 10 minutes before sleep, alternating both wrists. This is particularly effective when racing thoughts are the main barrier to falling asleep. To bring this into a practical daily structure, consider the following approach. During the day, when tension builds, headache develops, or digestion feels sluggish, stimulate HEGU for 1 to 2 minutes per side. When emotional overload or anxiety arises, and your heart rate feels elevated, shift to Lao Gong, pressing the palm center while breathing slowly and deliberately. In the evening, as you prepare for sleep, especially when the mind refuses to quiet, spend 5 to 10 minutes on Shenmen, working both wrists with gentle but consistent pressure. A 2023 clinical study involving 60 patients undergoing coronary angiography found that hand reflexology applied after the procedure reduced moderate and severe anxiety scores significantly. Within 2 hours, brought intractable pain scores down dramatically across both 2-hour and 3-day follow-up periods, and cut severe fatigue reporting from 33% to 10%. The researchers attributed these effects to gate control mechanisms, blocking pain signal transmission, combined with endorphin release, triggered by skin and nerve stimulation. The hands are extraordinarily accessible, always present, requiring no equipment, and physiologically rich enough to serve as a genuinely useful interface between intention and bodily state. What the research supports is not a claim that pressing your palm cures disease, but that deliberate stimulation of specific points activates real neurochemical pathways, with measurable downstream effects on pain, stress, and sleep. Used as a daily complement to medical care and healthy habits, these 3 points are among the most practical self-care tools available.